This is a lecture on Chapter 21 of the Language of Medicine. That chapter is entitled Pharmacology. Every other chapter that we've studied in this class, the chapters have come from the book titled Essentials of Human Diseases and Conditions. And for every other chapter, it is important that you read the chapter, that you study these PowerPoints and listen to the audio. For Chapter 21, you can actually learn the information necessary by just listening to the audio and studying the PowerPoint slides. I will make these particular slides available for you in print form. Pharmacology, the field of medicine that studies drugs, their nature, origin, and effect on the body. Realizing that drugs can either be chemicals that are synthesized in the lab or biological substances that are used in the prevention or treatment of disease, or to alter body functions in hopefully a beneficial way. Drugs are dispensed by pharmacists at a pharmacy. All of the drugs have a potential harmful effect on the body if misused, abused, or the person takes too many of the drugs or mixes certain drugs and other substances. So toxicology is part of the study of pharmacology to understand the harmful effect these medications can have on the body. All the drug names have three names. The chemical name, which is the chemical formula that you're not going to have to even worry about in this class. You should know about generic names. Generic names, there's only one generic name per drug. When you write the name of a generic name, do not capitalize the generic name unless, of course, it's the first word in a sentence. The brand name, you always capitalize the brand name, the first letter of the brand name. Most drugs have several brand names, but only one official name, one generic name. And you've been seeing the use of generic and brand name drugs as I've talked about them in other chapters. It's the United States Food and Drug Administration, the FDA, that has the legal responsibility for deciding whether a drug may be distributed and sold in the United States. There are several really good drug references out there, the hospital formulary being the most complete and up-to-date list. Physician's desk reference is just one of those, but there are many wonderful drug references that you can use, especially those available on the internet. When we look at administration of a drug, a patient may take the drug by mouth, oral administration. Sublingual is a kind of a form of oral, but the person doesn't swallow it. They just put the medication under their tongue. Sublingual means under the tongue. Rectal administration would be in the form of suppositories. Parenteral administration is any way except through the digestive tract. Oral and rectal, both of those administration routes are through the digestive tract, one end or the other. Parenteral, this is in the form of the injections. Injecting medications under the skin is subcutaneous, and intradermal further into the skin, intramuscular, IM, those are many injections are given IM, intravenous injections, IV, or infusions. The intrathecal administration of a drug intrathecally is actually placing that drug, infusing it into the meninges and the sheath around the spinal cord. Intracavitary is directly inserting the drugs into a cavity, a body cavity like the abdominal cavity. A person could inhale the drug that they're taking or that they need. Inhalation, they breathe in the little droplets of aerosols, breathe in through their nose and respiratory tract. Topical administration of drugs is making the drug go through the skin, like rubbing it on the skin in a lotion form or ointment. or they're also subdermal. I'm sorry, I said the word subdermal. Transdermal, which means through the skin, patches that can be worn that the drug will go through the skin. Terminology that's used often in pharmacology, the term iatrogenic refers to conditions produced by treatment, conditions that result from mistakes in drug use, that maybe the patient is given the wrong medication or given too much of a particular medication. These are mistakes. These are things that shouldn't happen, the iatrogenic conditions. Side effects are expected. Side effects are adverse effects that are routinely expected from the use of a drug, like Benadryl. Many people have the side effect of Benadryl, this antihistamine, makes them sleepy. It's an expected side effect. Contraindications. Factors in a patient's condition that make the use of a drug dangerous and ill-advised. For instance, if the person were allergic to a particular drug, and that was the drug they needed to take to cure them or make them better, they've got a contraindication. They don't need to use that drug because they're allergic to it. Contraindication. Classes of drugs. The analgesics relieve pain. Examples of those: acetaminophen is a generic name. One of the brand names is Tylenol. Aspirin is an analgesic. One of the brand names Bayer. Analgesics also include the non-steroidal anti-inflammatory drugs, abbreviated NSAIDs. Ibuprofen is a generic name. Advil is one of the brand names. And then there are the more potent analgesics that are in the narcotics family. The opioids and Demerol, morphine, such as that. Analgesics relieve pain, but the anesthetics take away all the feeling. Anesthetics are used before a person is going to have a procedure performed. It could be general anesthetic if they're going to have major surgery. It could be a local anesthetic to take away the pain of some minor procedure. Antibiotics, chemical substances either produced by other microorganisms or produced in a lab. These antibiotics will inhibit or kill bacteria, fungi, and other parasites. I've given examples of some anti-tuberculosis antibiotics, some antibiotics that are in the group called the cephalosporins, antibiotics in the group of the erythromycins, and the penicillins. As usual, anytime you see the name of a drug on a slide or on a presentation, a lecture, I've got the name of the generic drug not capitalized and then the brand name capitalized and in parentheses. If I ask these questions on the test, which I will ask some questions about medications on the test, you'll need to know and recognize what these drugs are used for. I won't ask you what is the brand name for amoxicillin. If I'm going to ask you anything about amoxicillin, it will be what type of drug is amoxicillin, but I'll use the word amoxicillin and amoxil so you can learn either the brand or the generic. I would ask, what type of drug it is, and you would tell me it's an antibiotic in the penicillin family. Of course, that will be multiple choice because your questions are multiple choice. These are some of the antiviral drugs used against viruses such as herpes, Epstein-Barr, and even HIV. Oops, I should leave that on the screen another minute for you, but you can print these particular slides. I've posted them under course content. Examples of the antiviral drugs are given here, the Retrovir and the Zovirax. Anticoagulants prevent the clotting of blood. They prevent the coagulation of blood. Heparin, sodium warfarin, widely used anticoagulants. Anticonvulsants are drugs to stop convulsions or to prevent or reduce the severity of seizures. Tegretol, Dilantin, phenobarbital, they're all anticonvulsants. And there are many other anticonvulsants also. Antidepressants, I've just named a couple of them here, used to treat symptoms of depression. Anti-diabetic drugs, if a person is taking insulin, they may be taking the insulin brand name Humulin. And then there's anti-diabetic drugs for those patients that are considered to be type 2 or non-insulin dependent. They may take Diabetes, Glucotrol, Glucophage. There's a number of anti-diabetic drugs that can be used rather than using insulin to control blood sugar and insulin levels. The antihistamines are drugs to be used in treating allergic reactions. The antihistamines block the action of histamine, which is released when the body has an allergic reaction. And I've used brand name Benadryl. It's so commonly used as an antihistamine. Anti-osteoporosis drugs. I talked in an earlier chapter about osteoporosis, the disorder in which the person loses bone density. Here's a couple of the drugs that are widely used to treat osteoporosis. And then cardiovascular drugs, drugs that act on the heart and the blood vessels. Here's digoxin that slows the heart rate, causes the heart to pump more forcefully. Angiotensin converting enzymes, ACE inhibitors, will keep blood vessels dilated to lower blood pressure. They're especially used in the treatment of congestive heart failure to improve the performance of the heart. A couple of examples there, Zestril and Potent. Additional cardiovascular drugs, the beta blockers like Lopressor, calcium channel blockers like Procardia. Both of those are helpful in treating arrhythmias, abnormal heart rates. Diuretics will help reduce the blood pressure by reducing the volume of the blood. Diuretics promote water to leave the body. Diuretics are useful when a person with congestive heart failure has extreme edema, swelling. Lasix is used to get the edema off the body. Cholesterol-lowering drugs are widely used to help a person who has high cholesterol levels. Lopid, Mevacor. Endocrine drugs, when I talk about endocrine drugs, these are either naturally occurring or synthetic hormones. Many different forms of estrogen have been developed for women. Synthroid is widely used to treat people who have hypothyroidism. Gastrointestinal drugs, there's a number of different actions that these drugs will have to relieve symptoms from the gastrointestinal tract. There's anti-nausea drugs like Antivert. There's drugs to treat gastric and peptic ulcers, or just known as antacids, Tagamet, Zantac. And I'm certainly not covering all of the drugs. I'm just giving you some examples that you may be tested on. And hopefully through working through the drug assignment, you've learned how to find out about drugs yourself, how to use drug references and even the internet as sources of discovering more about the drugs. It's virtually impossible to know all the effects of all the drugs and the classes that they're in. We have to know about how to use references. Here's a couple of examples of bronchodilators, respiratory drugs that would be used in the treatment of emphysema, asthma, bronchitis. There's albuterol and epinephrine. Sedatives relax and calm nervousness. Restoril is an example of that. Stimulants act on the brain and speed up the vital processes. Well-known drug, caffeine. Well, you don't even think of it as a drug because it's certainly legal and you don't have to have a prescription for it. You just buy it and give it to our children, but it truly does speed up vital processes in the body. It's a stimulant. Ritalin is actually a stimulant that's used to treat a person that's hyperactive. If a person's truly hyperactive, Ritalin will slow them down. Tranquilizers are useful in controlling anxiety. Commonly used tranquilizers, Valium and Xanax. I also want to talk about the steroid anti-inflammatory agents. Decadron, Solumedrol, Prednisone. When a person is taking steroids, they have to be slowly withdrawn from those steroids, or they'll have some very serious effects from just going cold turkey from the use of steroids. Also, if a person is on long-term use of steroids, they're very likely to develop some adverse effects, like ulcers. There's a steroid diabetes. The person that's on long-term steroid use is more susceptible to infection. They'll have edema, blood pressure goes up, hypertension. Hypokalemia, they may actually lose their potassium. They'll develop osteoporosis, menstrual abnormalities, Cushing's disease. You can look at these Cushing's back in the endocrine chapter. Depression, insomnia, all go along with the use of steroids. These are some pharmacology terms that you should know. Many of them I already talked about. The analgesics that relieve pain, the bronchodilators that dilate bronchial tubes. Chemotherapy is treatment with drugs. But we usually only use that term to refer to the cancer chemotherapy. Subcutaneous is below the skin. Hypodermic is also below the skin, as in injections below the skin. Anesthesia, I talked about, take away the feeling, all the sensory perception. Antihistamines work against histamine in treating allergies. Hypnotics induce sleep. Iatrogenic refers to something caused by treatment. Sublingual is under the tongue. Narcotics induce sleep or a stupor-like state. And antipyretics work against itching. The medical term for itching is pruritus. More of these terms. Fever, the medical term for fever is pyrexia. It's also febrile. Antipyretic works against fever. Intrathecal, I mentioned a few minutes ago, is an injection into the sheath of the spinal cord. Toxic, pertaining to poison. Toxicology studies the poison or harmful effects of drugs. Vasodilators dilate blood vessels and other vessels. Intravenous refers to giving the drug in the vein, intravenous IV. Vitamins are drugs found in foods and can obviously be taken as supplements also. Anaphylaxis is an extreme allergic reaction. We mention it here because a person that is allergic to medications may have this severe allergic reaction, anaphylactic reaction, in which they quit breathing because they're given a drug they're allergic to. Antidotes work against what is given. Antidotes, if a person is, there are some drugs that if a person is given an antidote can be given to counteract that action. Contraindication, I talked about a few minutes ago. If the person has a particular condition, then the drug that is best to treat that condition may not be able to be used because of some other condition the patient has. There are some drugs, for instance, that are taken out of the body by way of the kidneys, and they're very damaging to the kidneys. Well, a person that already has kidney damage, or maybe just has one kidney, has a contraindication to taking those medications. Parenteral, the words are apart from the intestine. It's referring to medications or other substances that are given some way besides through the gastrointestinal tract, like intramuscular, intravenously. Common pharmacology abbreviations. AC means before meals, as in taking a medication before you eat. Ad lib, freely as desired. The person can take just as much as they need to, whenever they need to. BID is 2 times a day. This C should have a line over it, because C with a line over it means with. FDA is the Food and Drug Administration. GM is gram. GT is drops, as in eye drops or ear drops. GT or GTT. H stands for hour. IM, intramuscular. IV, I've talked about a few minutes ago, is intravenous. NPO means nothing by mouth. PC means after meals. PDR is a physician's desk reference, widely used to look up drugs, learn about drugs. PO is by mouth. If a drug is to be taken by mouth, the physician may write the prescription as PO. PRN is when requested, that the physician can request that they're in pain and they need additional medications, for instance. Q is every. QH is every hour. QID 4 times a day. An S with a line over it means without. TID is 3 times a day. Okay, this concludes the lecture for Chapter 21 of the Language of Medicine.